This conference will now be recorded.
Okay, so the agenda for today, after the welcome and introductions, we will be covering some consent changes updates, the GN recent release, the biosample shipping, the pathology flowchart, CureGN fall face-to-face meeting, and some tips on completing the remote and chart review visits. And then I'll just have some reminders before we wrap it up. So for the consent changes updates, I'm going to pass this over to Becky Scher from U of M, who is one of the project managers here at the DCC.
Hi, thanks, Melissa. So I just wanted to go over some of the consent change updates that we've sort of been talking about. I'm sure you've heard about them, but I just wanted to reconfirm and remind you all that this is still in progress. So there'll be 3 consent updates total so far. So the first one is a payment schedule update, and this is the payment schedule update that you were all contacted about with the new language insertion, and we also, we contacted you about having any sort of site-specific inclusive language as well. So what you'll see here in purple is what will be inserted into everybody's consent, which is the new payment schedule. And it'll also include any of the site-specific language that you've requested to be inserted as well. The second change is our IRB has changed names from E&I to Salus. It's the same group of people, but the company was bought by Salus, and so they are now Salus IRB, so we will go ahead and make those updated changes to the name in your consents as well. And then the third consent update is we are inserting the language that's in purple into your consent, and it's just, again, it just says stored excess kidney tissue from past kidney biopsies will be requested, and then the digital copies and excess tissue will be stored in the study. So this is just adding a little bit of extra language of talking about how we're going to be storing and keeping some of the excess tissue. All of these changes were approved by the DCC, and we're going to be making those corrections on our side and submitting it to the IRB for you. So you will not need to do anything other than just receive your updated copy of the consent. If you have any questions, feel free to reach out to CureGN Regulatory, and I'm happy to help you or walk you through any questions or concerns that you have. So that's it for me.
Thank you, Becky. Does anybody have any questions for Becky regarding the new consents? Okay, so now we'll go on to the current GN link release. A lot of these now are not going to actually pertain to you guys where you'll see it, but I just wanted to make sure that you're aware that these things were happening. So regarding pathology and core scoring, we've added the biopsy ID to the pathology CRF. There was a new question added to check if the report has any HIPAA or if it doesn't have a biopsy ID. And then also we added an option to filter on the biopsy ID on the core scoring tab, and not available option was added to a couple of questions on the core scoring forms. And I know that the core scorers are feverishly getting those core scoring done for the DPR. Okay, then for the DPR, the scanning facility completion form updated to show that the list of barcodes have been received. The study ID column added to the DCC tab in the DPR facility. And then the facility ID has been to the shipping facility task under the scanning facilities. So I'm sure those of you who had sent slides to the DPR for Cure2 have received a notification that those were shipped back, and just make sure that when you do get those notifications, you go in and check those labels back in so that we have a record that you should indeed get those labels or those slides back. Okay, some other changes for CureGN diabetes for those of you that are on that study. The core scoring CRF has been updated. And then for CureGN, the enrolling biopsy material event will be suppressed unless the pathology report is uploaded. So just make sure that you've uploaded the pathology report in order to upload any EM images or slide copies. And a checkbox has been added to the login screen for the user to accept the terms of use. Only if the checkbox is checked will the user be able to sign in. And this will only ask you the first time you log in. If cookies or cache is cleared, then it will show you the checkbox again. But you're not going to have to do this every single time you log in. And the final change that I know everyone is excited about, I was excited about, is that you are now able to unlink the barcodes on the blood and urine collection form and the pathology slide form. So all the barcodes that are generated and sent to shipping button is clicked, then the unlink barcodes button will be unsuppressed. Okay, and then if you would like to update any of the barcodes after sending them to shipping, you just click that button, and then you can use the to make any of the barcode grid editable. And then after clicking the unlinked barcodes, you can go back to the biosample collection worksheet to update the barcodes. And then once the barcodes are updated, you can send back to shipping. And then if you've already shipped the samples though, you'll just need to contact us because this is only for those that have been unshipped, not shipped yet. Okay. So biosample shipping, and we'll go ahead and give you a little preview here. Okay, so I'm just going to go into a test facility. I'm not going to worry about the census password. And as we all know, it takes a few minutes or a few seconds, hopefully not a few minutes to get in. There we go. And if you find, here's one tip for you. If you're finding that it's taking an extremely long time for you to get to this page, check to see how many overdue study tasks you have. Like this has quite a few because it's a test site. We don't go back in and do them, but that contributes to how long it takes you to get to this main page, the home page. Okay. So if we go into the census here and pick a participant at random. Okay, so let's go into a blood and urine collection. And I just want to kind of go over some of the steps just to make sure everybody is aware and completing them all. So you can do a prep if you want to do it ahead of time before the participant comes in, or you can go ahead and mark it collected when once you've collected them. If you don't collect any, but you had to discard them or whatever, you can go ahead and mark those as well. You need to put in the sample kit and the date. And then you need to put in a barcode. Now we do suggest that you scan as opposed to type them in, just because it does help with user error. There's always a chance when you type it in that you are going to hit a wrong number. I do it all the time. So like I said, it's just easier if you do scan. And then you generate the barcodes and they all show up in this grid for that kit. Now you can, if you're collecting everything or just if you're collecting most things, you can just click this collected button and everything will be marked as collected, okay? And then if there's some on here that you didn't collect, you can just go ahead and just change those. I just find it's easier to mark them all as collected if you've only got one or two. Oh, this is like 5 that wasn't collected, okay? And then go ahead and hit the continue button. And if you see here, this is it's kind of grayed out. It's not as dark as what the send to shipping button is. So once we hit send to shipping, you'll see this gets grayed out and then the unlinked barcodes is now usable. So if we go back to here and you realize like, oh, I need to change something on this. And of course you can't. So if you go back to the send to shipping button and hit unlinked barcodes, now you can go back in and make whatever changes you want. So say you had the wrong barcode, okay? You can actually delete all rows okay? And then just go up here and change the barcode. So we'll change it. And then hit generate barcodes again. And once again, you can mark them all as collected. Change any that you wanted to change. And then hit continue and send to shipping again. Okay. And of course, if you have to go back in and change something again, you can still do that because these haven't been sent to shipping. Okay. Or I'm sorry, they haven't been shipped. They've been sent to shipping. Okay. Any questions about that new feature? And Madalena, yes, this is a very welcome update. We're all very excited to see this. Okay. Oh, material management. We don't want that page actually. So if we go to facility tasks, and so here under event, so just to kind of remind people what all of these are, shipping to the PCC, that's if your PC requires you to send your DNA, RNA directly to them. That's what you would use this manifest for. Shipping to the scanning facility is when you ship the slides to the DPR. And then the receiving facility is when you receive them back. You need to go in and just mark them as received. And we can show that real quick. And you'll mark them back as you received it intact, or if it was missing or broken, which we really hope nothing is missing or broken. But that's all you have to do is just mark those and to put the date that you received them back, and then complete receiving. Okay. And then, of course, shipping to NIDDK is where you want to ship all of the biosamples. Okay. So once you go in, again, you can mark everything at once as shipped. This is really helpful if you're clearing out your freezers like you should be once a month and getting those shipped. You can always go in and complete something, mark it as not shipped. So say we didn't want to ship those 2 samples. Go ahead and put in your carrier and your tracking number. And then the date you're shipping, and hit continue. Now, when it says to print 2 copies of this for your records, neither one of these should not be sent to the repository through email, because that's going to be a PDF copy. Okay. So when you get to the second page here, it'll show you how many samples you're shipping and what types they are. Confirm that the count that you have here matches what's in the box. So here it would be 16. So make sure you have 16 samples in the box, okay? It's just very important to make sure you have the right amount of samples in the box, because that really helps eliminate missing samples or sending samples that aren't on the manifest. And if you're clearing out your freezer when you ship, then you should have all the correct samples, okay? I've seen a lot of errors coming through where samples are being sent to the repository, but they're not on the manifest, or they're on the manifest and they're not being received at the repository. So we just kind of want to eliminate that. And by just checking to make sure that what the count says is what you have in the box, okay? And then you would send to shipping. And that's just basically creating the manifest on the back end. And then this is how you want to email the manifest to the DPR, or I'm sorry, to the repository. So you click and you wait for the pop-up to come up, okay? And you'll see it has the name. It should have the repository name up here. This doesn't, because this is a test site. And then your name should also be on the CC line. If your name is not on the CC line, you can add it. So let me move some of this so you can see. There's a lot of people on our test site. But yeah, so you can actually do that. Okay, so you can make those changes. And then it has the subject that is your shipping manifest. And then you see the attachment, and it's in a CSV file, which is the correct for sending to the DPR. This is the version that they need so that they can incorporate it into their system. Okay. There's a note, and if you needed to change anything, like say you're resending a manifest because they said they didn't get it the first time, you could just go ahead and go in here and again, make any changes. So you can just resending per request. Okay. And then you would hit send. Yes, and it's hard, you can't grab it. I'm just deleting it so everybody else doesn't have to get a copy of this right now. So yeah, so once you hit send, and you only have to click it once, and it does take a few minutes, and you'll get the little pause, and then voila, it's gone through. And then this is the email that you'll see. This is one I did yesterday, but it has the CSV file on it, okay? And you can always take this for your records as well, okay? If you didn't want to print out the PDF copy, but you wanted to print a CSV file so you have it, you can do that. Okay. Just make sure there is a paper copy of either the CSV file or the PDF in the box with the samples. Okay. Okay, any questions about shipping? Another question that came up yesterday that I just wanted to remind everybody about, if you go into the, oops, well, we can use this, into any of the CRFs, you're going to see an entire form progress as well as the current page process. So this is telling me only 17% of this full form has been completed, okay? And actually, I want to go in, let's go into an actual CRF because I want to show you how you can see where you've left off. Okay, there we go, follow-up CRF. Okay, so when we first come in, nothing's been completed, okay? And the page progress is 0. And all of these are grayed out, okay? So when we start entering everything, you will see the current page progress. Okay, and it keeps going up as we do, and it increases every time you save an answer. Okay. Okay, and so you'll see it's at 90%, but I've answered all the questions. If you just hit the save check mark, it automatically takes it to 100, okay? Now, when you're completing the forms, and now the entire form progress is 9%, okay? If it's red, it's under 25% of the form page has been completed, up through 75% is yellow, and then over 75% is red, okay? And then you'll notice like this, it shows as red, even though I haven't put anything in. But if I go back to the demographics, this will still show as red. So that means that's the last page I was on because the others are still grayed out. So say you had to get out of the form, you're completing it, something happens, you have to step away from your computer. When you come back, that's an easy way to tell where you left off at, is like which one is the last one with the color on it, okay? Any questions about link? Then what I'm going to do is go back here. So we have created a couple of pathology flowcharts because we wanted to make sure that you guys understood what all the different progress was. So this one, we will be putting these on the study website. As you can see, it's hard to show you the whole thing here on a PowerPoint, but it just kind of the basics is what I put here. So you enroll a participant, you de-identify the biopsy report per the instructions in the BOP Appendix K. You upload the biopsy or pathology report to GNLink. Then the DCC will QC the pathology report. If it's not de-identified correctly or it's not labeled correctly, we contact the site and then you correct the report and upload it. If it is correct, Then we send it on to the enrolling pathologist, and the pathologist reviews the report. If it's complete and sufficient, they complete the pathology CRF, which sends a notification to you regarding the enrollment status, letting you know if they're eligible or not. Now, if the report's not complete and sufficient, the pathologist will request the EM images and slides, and so you will send those to them, and then it'll go back to where the pathology reviews the report. And this has more information in it, so you'll have to take a look once we get it uploaded. So this is the EM slide and slide collection workflow. So at the site, you will label the biopsy slides and de-identify and label the EM images. You'll upload the EM images to Link, and for the slides, you'll create a slide copy and upload them to the Link. The DCC then QCs the slides and EM images. If they are labeled correctly and de-identified correctly, we'll notify you that you can go ahead and send the slides to the repository, okay, or that the EM images pass QC. If they're not de-identified or labeled correctly, we'll let you know what corrections need to be made and for you to let us know when you've uploaded it. So you make your required changes and then upload the new version, and it goes back to the QC process. Okay. Any questions? All right. Well, then I am going to pass this over to Dr. Laura Mariani, who I'm sure most of you are familiar with, and she's going to discuss the fall face-to-face meeting.
All right, hi everyone. I just want to say before we get started, just number one, of course, thank you for taking the time to join the town hall, but thank you even more for all of the work you do to support CureGN. I think you probably don't see it, but CureGN has built this amazing, amazing resource based on all of your efforts in the clinics and with the patients. It's almost weekly now that I'm getting a new investigator, a new company, a new institution coming to us, wanting to access the CureGN data and samples. And I think it just speaks to what a unique and valuable resource CureGN is to be able to change the way we're taking care of these patients. There's so much exciting things coming down the pipeline, new therapies, new understandings of biology, and having Cure as just a resource for people to quickly access and move those things forward. I just can't tell you how potentially impactful that is. So please don't lose sight of that when you're unlinking barcodes. That's really, really valuable that specimen is going to get used and we'll learn new knowledge from it. So thank you for that. So what I wanted to mention today was we are back to having a face-to-face meeting. So in December 6th and 7th in Baltimore, we're going to have an investigator and a coordinator meeting. And my pitch is, if you can make space for it, we would love to see you in person. I think I'm looking forward to being able to kind of hear directly from you about what's going on the ground, but also just to build a community of all the people that are doing the hard work. So just to give you a sneak peek, there will be essentially some sessions that are everyone together and some parallel sessions. So this is the agenda that's kind of been worked out for the investigators, but the first half of it I think would be relevant for you as well. So it talks about state of the study, kind of what we're already starting to learn from the data we have in hand. There are going to be some scientific talks about what are sort of very cutting edge things we can use with the CureGN resources, some questions that we can answer. We're going to highlight a lot of the junior faculty that have gotten involved in CureGN by having a research abstract session. So lots of back-to-back short things. So I think all of that just to make sure you can see where all your data and samples are being used would be great. The coordinators will have a separate session on the next slide that we're still working on the agenda, and thank you to the lead coordinators for really helping us make sure that any in-person time is worth it. So we think we'd like to have a few different breakouts because we know some coordinators are new to CureGN, some have been around a long time. So for those who are interested in, for example, intro to glomerular disease or nephrology, we'll give you some background there. We have some specific pieces of the protocol that are being highly requested, and we just want to make sure that you all know sort of why that data is being requested. Some tips and tricks of where to find it, and then what it's going to be used for. Then we have some, again, I think can be some good group learning about different tips and tricks using CureGN Link. We are going to invite the programmers as well. So this will be a great opportunity for you to give feedback directly to the programming team about what works in Link, what doesn't, what fits your workflow, what doesn't, and also for them to show you kind of how they envision some of these tools and how to best use them. Similarly, the people that run Basecamp and QMT will be there as well, so we can make those resources really useful to you and hopefully make your job easier. Finally, we do want some time, like I said, just to build community. So we're really happy that NephCure Kidney International, that patient advocacy organization, they have agreed to fund a group coordinator dinner that night. And on the second page, again, we'd like to start the day with the focus on sort of what's actually happening at the site. So we have best practices for running a CureGN site that we'd like to, we're inviting both some investigators and some coordinators to lead that panel, and then a specific coordinator panel. So really to you to be able to push back important messages that you think the whole consortium needs to know about what it's like to run this study, what works, what doesn't, and then sort of what are the big goals from a coordinator perspective to sort of continue to maintain this study, and especially as we look towards even longer term follow-up for these patients to understand what happens to them over the course of their disease. So I hope it sounds interesting to you guys. I would love, love, love to see you in person. There will be a hybrid option available. Obviously, I know how that goes. And then if you have specific requests or things you'd like to see or be a part of, or sessions that you'd like to have that you think would be really valuable, you can either send them directly to us, to me, or to your lead coordinators. I think that's it.
Thanks, Laura. Yes, we all look forward to seeing everybody in person. That's so long. Does anyone have any questions about the face-to-face meeting or for Laura? Everyone's being very quiet this morning. Okay, so now I'm going to turn this over to Caroline Polton, who is the PCC lead coordinator for the UNC PCC. And she's going to discuss some tips for completing remote and chart review visits.
Thank you, Melissa. Hi, everybody. If you don't know me, yes, I'm Caroline Polton. I'm also the co-chair of the Recruitment and Retention Committee, and so we thought it might be good to do a little refresher. We talk a lot about retention of subjects long-term into the study and making sure people aren't lost to follow-up. And visit retention really goes hand in hand with that. So with the help of Sean Sullivan from the DCC, we put together a couple of slides just to go through this. Okay, and I included some old-fashioned pictures just for fun, so you can see we have our stone booths over down in the far right corner. And this is to go with the tip of doing calls around lunchtime. This may be a good time to catch participants or parents to either go on and collect that remote visit or schedule a time to recontact. And it's also good to try to do calls to participants about halfway through their visit windows to make sure that you are catching them and giving them ample time to set another time possibly to do the remote visit. That patient visit by status report can be a really useful tool here in terms of making sure you know when the visit windows are coming up and when they're ending. You can go on to the next page, next slide. Oh, I think we skipped one, or maybe not. Yeah, go ahead. Okay, I don't have enough coffee yet. Our next tip is trying to use more of a conversational script when you're doing those remote phone calls. If you're sitting and reading off the CRF, it can get kind of monotonous. It may take actually a longer time to go through the questions. So we are working on approval of a standardized phone script Some of you may have had these approved already at your local sites, especially with CureGN 1 when we were kind of all separated for IRBs. But we are working on approval of a standardized phone script that you can use. It's a little bit more conversational. It still gets all the information you need, but hopefully will help make your remote visits more efficient over the phone. Another thing you can do is write down a fact about the subject that you can revisit at each call. Do they have pets? Do they have a kid in school? Have they mentioned something that you can follow up on to kind of keep that thread of connection going throughout the time that they're in the study? Okay, you can go on to the next one. And this is our classic voicemail machine. I miss these. You could go home, you'd see your little light flashing, and you could check your tape for your voicemails. Voicemails can be used for CureGN. You know, you can only put a limited amount of information in those voicemails, but it's great to say, hey, I want to, give you a call. Let's chat for 5 to 10 minutes. I think a lot of times the remote visits sound more painful than they are. They can actually be fairly quick. So if your subjects know they're only going to be asked for a short amount of their time, a return call may be more likely to come. Next slide. Another thing to try, I think people have been hesitant about doing this, but you can definitely use email for these remote visits. Some of your participants may really like this format. Again, we have scripts that we were using back in CureGN 1, and we are working on some standardized scripts to use for CureGN 2 that will be IRB approved by the central IRB. But this is definitely a way to get the information that you need. You do want to make sure that you're sending these via encrypted email unless you have institutional permission to do it otherwise. Every site, every institution at this point should have a way to send encrypted emails. And if you're not sure how your site does it, Google your site, like my site's UNC, you can Google UNC or whatever your site is, privacy office, and find that person and chat with them about the way to do this. It will take a little bit of training for your subjects to know what they're going to see when they get the encrypted email and how to open it. But this is definitely something that could work for some of your subjects if you aren't already doing it. Next slide. And then finally, investigate your EHR. I know a lot of you probably know Benedict Cumberbatch, but maybe you didn't know that he was kind of got his start in PBS's Sherlock Holmes. It's good if you haven't seen it. Be a Sherlock Holmes and make it a fact-gathering mission when you go into the EPIC or whatever your electronic health record is. We now have this great opportunity to utilize chart review visits. And these can be used on anyone who signed consent into CureGN 2. So this is a great way to go back. I know that it's time consuming, but you may find that you can fill in a lot of those missing gaps with information from your EHR. Use that media tab to find notes and labs that are scanned in from other providers. If you have Care Everywhere, you may find some labs or even biopsy reports in there. Just make sure that your institution allows you to use the notes from Care Everywhere for research. You can use embedded labs in notes. This is especially important for those labs at biopsy or presentation. If you have someone who was a referral from an outside institution, see if you can find some of those labs in those notes. They can be used as a source document. And then finally, you can utilize the search function within your EHR. Of course, it's a great tool for hunting down medications, but you can also look for outcomes, dialysis, transplant, COVID. These are other ways to try to kind of fill in the gap for those subjects. Next slide. And then finally, ask for reports. Don't be scared to ask the DCC, or really probably you should ask your lead coordinator to ask the DCC for reports. We have a lot of information that we collect that we can now use for us too. One of the things we can ask for are a list of, missed visits. So we can look at all of your enrolled subjects who have missed visits. And that's a way for you to go back in and say, hey, is there a clinic visit or a specialist visit or something in the EHR that I could use to fill in that visit? And I've had a couple sites who've had really good luck utilizing this. The other thing you can do is, find your high priority visit windows. So these are subjects who may have missed the most recent 2 visits. Those are the ones that we call our at-risk population. These are ones that you may want to prioritize and make sure that you're getting in. So this is another, report that we can have the DCC run for us. So don't be afraid to ask to use data. If there's a question that you want to have answered, reach out to your lead coordinator and say, hey, how could I get this question answered so I can be better, or to help me better find who I need to get back in touch with. I think that's all I have, Melissa. If people have other ideas or best practices, please feel free to put them in the chat. And I think that's it for me. Thank you.
Thank you, Caroline. Very good tips. Does anyone have any questions for Caroline? Okay. If you do, you can always email the DCC and we will get those questions to her. So we have just a couple of reminders. If you have any issues with GNLink, we do want you to email the CureGN project management email as well as the CureGN help. That way a ticket can be automatically created for you. And it's always a good idea to copy your PCC lead coordinator on emails as well. And please make sure to include any examples such as study ID, visit, CRF that you're using, that you've encountered their problem. If you can get a screenshot of an error message, that's great. Just the more information you give us, the more likely we are going to be able to figure out what's happening. Okay. The next round of town halls is going to be in January of 2023, not 2022. Since it was scheduled for December, but since we're having the face-to-face meeting, we're going to hold off until January for the next town halls. If you have any suggestions or ideas on what you would like to see at the town halls, because we want to make sure that these are beneficial to you, please just go ahead and email us at the CureGN-projectmanagement@arborresearch.org. Any comments, questions from anyone? For the fall in-person meeting, is there a specific hotel and when will we hear more about this? Yes, they are in the process of finalizing the details, and so we should be hearing shortly all the information on that. And they do have a hotel. Okay. All right. Once again, we really do appreciate you coming and spending the morning with us. Any questions you have, just please forward them on to the DCC at the CureGN project management email, and we will respond to you or get your email to the correct person who can help you. Okay. And we really hope to see everybody at the fall face-to-face meeting. And thank you to Laura, Becky, and Caroline for presenting today. All right, have a wonderful day.
Thanks, everybody.
Thank you. Bye-bye.
Thank you.